afternoon and welcome to our first Allied Health Day for Community College Week. We do have another Allied Health Day later in the week for other allied health programs, but today we are focusing on the veterinary technology, rad tech, and diagnostic medical sonography programs. My name is Nikki with Recruitment and Outreach, and I will be monitoring your question and answer space. So if you're following us on Facebook, please post those in the chat. I'll make sure we get your questions answered in the comment section rather. Again, for y'all here in the meeting with us, please post them in the chat or ask them afterwards. And our first presenter today is Michael Toops. So I'm going to hand it over to him.
Thank you, Ms. Dingle. Appreciate you inviting me to this. I'll go ahead and share my screen. All right. Is it shared? We good?
Yes.
Okay. All right. My name is Michael Toops. I'm the program director for the Diagnostic Medical Sonography program here at Delgado. And I thank you all for coming and watching these presentations. I just want to kind of go over my program first and to give you the qualifications for the ultrasound program. If you don't know what ultrasound is, basically is using sound waves, first of all, to image inside the body to get diagnostic results. So we have a program here at Delgado that's 16 months. It is a selection process that you have to apply to. So the qualifications to apply to the program would be to complete the application. There's an application on our website. We strongly recommend that you visit the sonography webpage on the Delgado site and review all the criteria that's needed for the application process. The first one, like we said, is the application itself. We also need for all applicants to review the technical standards of the profession and be able to agree that they can meet the technical standards in order to perform ultrasound. The other one is be a graduate of a 2-year associate accredited allied health occupation program, such as registered nurse, radiologic technology, respiratory therapist, occupational therapist, medical technologist, and anything, anything medically related. And the other option could be have 60 credit hours of post-secondary education to include the following coursework, which is you need to have A&P 1 and 2 lab, elementary physics, medical terminology, contemporary math, college algebra or introductory figures, English composition 1 and 2. So out of those 60 hours that you will get from the college courses, these courses must be included in those 60 credit hours. The program recommends that if you are going to apply to this program, that you do get an associate's degree in general studies first, and then apply to the ultrasound program thereafter. The only reason is this is a post-associate certificate program, and we would prefer you to have your associate's degree prior to entering or applying to the program. It's not necessary, but it is strongly recommended by the selection committee. If you are applying, all coursework must be completed by the end of the spring semester of the year you're going to apply. You cannot apply and then take courses in the following summer and wait to see if you get accepted. Everything has to be done by the spring semester of the year that you do apply. In order to take the A&P 1 and 2, at Delgado, you need to take biology 141 and 143 as a prerequisite to those courses. So as I mentioned before, we do recommend an associate's degree in general studies prior to applying. The applicants who go to other colleges or who have college credit older than 10 years should contact the Allied Health Admissions Office for advising to see if they will be accepted. One thing for our program, for the science the science courses. The science courses must be within 7 years. And that's only because with ultrasound, you're dealing with a lot of anatomy, and we have to be familiar with the anatomy once you accepted into the program. So yeah, so the A&Ps 1 and 2, and the physics course, those should be within 7 years of applying. In order to apply to the program, you must have a cumulative grade point average of 2.5, including all colleges attended. So if you have a 2.5 or above, you'll be able to apply to the program, and then we go on from there. But again, we strongly recommend that you send all your, contact our allied health advisors, and maybe send unofficial copies of your transcripts to them to get evaluated to see if you're going to need to take any courses, or if there's anything missing that you may need, so you know ahead of time. We recommend that you're doing this at least 2 semesters ahead, so you can kind of get an idea and plan, so that you don't plan to apply and then come to find out you need one more course and didn't know it or didn't realize it. The other thing is, we want you to be able to research ultrasound and be able to know what ultrasound is and what it entails. At this point, we usually have applicants do observation time at the various hospitals here in New Orleans. Currently this year, we have suspended that because of the fact that most hospitals are not allowing anyone to observe. So we are suspending that for 2021. But if you do find a hospital that will allow you to observe, we strongly recommend go ahead and observe, so you can see what an ultrasound department is, how it runs, and how you have to deal with and interact with patients. Because sometimes you realize you want to do it, but then you don't realize that you have to actually be touching patients and everything. So it just depends. But it's always best that we recommend that you get the observation hours. But this year, because of the COVID-19, we have suspended that. And again, once you complete the process, the application online, you need to go ahead and print it and then submit that with all the documentations that is on the sonography website. Okay, and I strongly recommend visiting the website, because there were some revisions that were made in January, and so so go back to the website and review, so you can send the most updated information in your application. With your application, we're going to need a copy of all official transcripts. I don't know if they're sending them by paper this year or if they're sending everything electronic, but I would suggest contacting your college. If it's Delgado courses, you don't need to do that. But if it's other than Delgado, then I would contact the universities and find out how are they submitting the official transcripts to Delgado. And the type personal statement basically is just a short, or just a narrative explaining your short and long-term goals, explaining your interest in the field of ultrasound. It's always helpful to give us a little bit of background about yourself. Why are you interested in it? What research have you done? And give us an idea, why you like ultrasound and why you want to do it. And I think that is the application process for right now. This year, we are not asking for any type of recommendation letters. That is not required in the package for this year. Okay. I hope I know I went through this kind of fast, but if there's any questions, I'll be glad to answer them. Any questions? Okay. Ms. Dingle, should I let Ty go?
Yeah, Michael, can you hear me?
Yeah, go ahead.
All right, I'm gonna, Michael, I think you got a question in the chat down there.
The question is, just to clarify, you need an associate's degree in general ed before applying. It is not required. It is strongly recommended that you have an associate's degree in general education before applying. And like I said, only because we're a post-associate certificate program, and the college would like you to have that general education degree, associate's degree, prior to applying. But it is not necessary that you have the associate's degree. So you can apply even though you don't have it. We may ask you to try to finish that degree while in program, which would be very difficult because the ultrasound program itself is intense, but we strongly don't recommend students taking extra courses outside of this program, just because we want you to focus on learning ultrasound itself. But no, you do not have to have an associate's degree before applying, technically. Anything else? Anybody else? Any other comments? Okay. I'm going to have Lisa Schuler back me up after a while, but we'll be around. So if Ty, if you want to start off with your program.
Okay. Hi, everyone. My name is Ty Delgado. I am the program director for Delgado's Radiologic Technology program. If you have any questions afterwards, feel free to ask. You can always do it in the chat. I have a little PowerPoint that I'll try to share with you guys. Let's see where my PowerPoint is over here. And let me go to my slideshow. All right, can everyone see this? I hope everybody can see my slideshow. So I'm representing the Delgado Community College Radiologic Technology program. If anyone has any questions, feel free to ask. The history of radiology: Wilhelm Röntgen discovered x-rays in 1895. First x-rays was of his wife's hand, which was on a piece of glass. X-rays were used for entertainment, checked for foot sizes, used at circuses, bone portraits, home models were even sold for parties. In the beginning, there were a lot of safety issues due to the unknown hazards of radiation exposure. What does an X-ray technologist do? Patient care. We deal with patients in various states of health, position patients correctly so desired anatomy is visualized. Radiation protection. We use time, distance, and shielding. Live X-ray exams using fluoroscopy, which is kind of like an X-ray video. Responsible for cleaning and stocking all X-ray rooms. Obtain and document patient history. Different modalities. We have something called diagnostic X-ray, which is the basic regular X-ray exams. We have CT scan, which is computerized tomography scans. MRI is underneath X-ray as far as a career. Mammography is also a career in imaging for X-ray. Nuclear medicine, angiography are also cath lab as well. These all fall under radiography. Purposes of medical X-rays, Purpose of medical X-rays to diagnose fractures and pathology. Fluoroscopy also diagnoses pathology. Modalities, we talked about the modalities already. Types of patients, there's outpatients, mostly ambulatory, sometimes immobile, various ages. There's also inpatients, various ages and conditions, some ambulatory, most are bedridden, some unconscious or pre-post surgical. Where can you work? As an x-ray tech, you can work in hospitals, you can work in outpatient facilities, doctor's offices, mobile radiography, travel tech agencies. How much money will you make? It varies on location, experience, and facilities. Averaging starting salaries is about $45,000 to $55,000 currently. Continued education. You can be cross-trained as a technologist. The tech can, you can be cross-trained to actually do CT, MRI, and different other exams as well to make a higher salary. Why choose Delgado? Tuition and books are inexpensive, more hands-on experience, a lot more clinic time than a 4-year program, only 24 months, opportunity to possibly work at hospitals when you finish your school. Program mission and goal. The mission of the Delgado Community College Radiologic Technology Program is to provide students with both academic and clinical instruction, which will prepare them to function as competent, compassionate, entry-level radiographers who respond professionally and ethically to patients and members of the healthcare community. ADA criteria for essential job function: must have visual acuity and manual dexterity to work with a computer, keyboard, and monitor to perform essential job functions. Must be able to hear and verbally communicate with the telephone for essential duties involving receiving and giving information. Must be able to lift, carry for short distances, push or pull a cart, weights in excess of 75 pounds to perform essential job functions. Once accepted, the student must pass a physical examination provided by your physician, pass a drug screening test, clear a background check, accreditation. The JRC-ERT, Joint Review Committee on Education and Radiologic Technology, it protects the students' welfare. It makes sure we are following the main governing bodies, and it adheres to Delgado's policies and procedures. Courses offered and required. These are some courses that some are mandatory courses and some of them are elective courses inside of the program itself. You would cover all these courses over a 2-year period of time. Prerequisite college courses. These are courses you would have to take before you could begin our program. Our program, you do have to apply. Every February 15th is the deadline for applications. So if you're on this Zoom right now and you're interested in the X-ray program, the next time you will be able to apply will be in February 15th of 2022 for the August cohort of 2022. The August cohort of 2021 is presently in the admission process. It's a closed admissions right now. So over the next month or two, we will have an admissions committee that is evaluating all of the applicants. We currently have 230 applicants, and we are going to take 50 students in our program this fall for our 2021 cohort. You must take English 101. You must take general biology as a prerequisite to anatomy and physiology. You must take math 120, A&P 1 and 2 with the labs, Psych 127, and a humanity elective. So these are the 8 courses that you must take as prerequisite to get into our radiography program. Check the www.dcc.edu and Google in search. Once you go to the web page, search Rad Tech or Radiologic Technology, and it'll send you to our web page so that you can get more information on our web page as it relates to admissions. The following radiographs show normal lumbar spine anatomy. Markers and legal considerations. What is a marker and where should it be placed? That is a left marker representing that left shoulder. Normally, we would want that left marker to not be in any of the anatomy. We would want it to be in the black space in the upper right-hand corner. So right now it is covering up some of the lung and some of the ribs, and we would not ideally want it in that location. First year rotations. Once you were accepted into our program, first year students would rotate through routine radiography, emergency room care, fluoroscopy, surgery, community radiology, which is like clinics, portables. Routine rotations. During your first year as a student at Delgado, you would rotate through routine diagnostic x-ray. Each day you'll be assigned to assist the technologist in performing various exams. Emergency center and express care rotations. Both first year and second year students will spend at least 1 month each year in the emergency center. There, the students will be exposed to a fast-paced and demanding facet of radiology. Fluoroscopy rotation. Fluoro is a branch of diagnostic radiology. Fluoro exams include barium enemas, small bowel follow-throughs, upper GIs, esophagograms, and other like studies requiring contrast agents. Modality rotation. You'll get to rotate through ultrasound or diagnostic medical sonography. That was Mr. Toops' program that he just discussed. Nuclear medicine, MRI, CT. Surgery or operating room rotations. During this rotation, the students will be exposed to exams done in the operating room, either during, after, or prior to surgery. Exams performed in this rotation are done using a portable C-arm x-ray machine. Portable rotations. Portables or bedside radiography is a form of mobile imaging done by our department. These portable x-ray machines are equipped to image unstable patients not capable of traveling to the department. Specialized senior year rotations. You get a 2-week rotation through CT. You would rotate through angiography, cath lab, MRI, ultrasound, nuclear medicine. CT scans, another modality in which the machine cuts the body into image slices to better view the internal organs of the body. Here, the student will learn the equipment and protocol for performing CT scans. This is a CT image of the abdomen and chest. Angiography is a modality that specializes in the imaging of the vessels in the body. Images are produced through the use of a C-arm, much like the one that is used in the operating rooms. Cardiac catheterization labs. In this modality, the students learn the importance of the studies done in the cath lab. Specialized images of the heart, great vessels, and placement of cardiac aids are produced here. Facial bones. Obviously, we want to get rid of as many foreign bodies. We don't want our patients wearing glasses when we take their x-ray. We don't want them wearing chains. Anything like that is going to cause an interference in seeing the image as we would like to see it and read it and have the doctor read the images. This would be a chest x-ray, a PA, and a lateral. Images of the abdomen with and without contrast agent. This is a fracture of the forearm. Appears to be a gunshot wound. Fracture of the hip. A lot of elderly people fall and break their hip. This is a tib fib with screws and plates. This is a boxer's fracture. Occurs during a punch with a closed fist. Usually involves the 5th metacarpal, but the 4th metacarpal also may be involved. Skeletal trauma radiology. This is a lower tib fib ankle area that has a fracture. A view of a normal pelvis. This is a fracture as well, the foot. So if you are interested in the Delgado radiography program, keep in mind, if you've already applied and you met the February 15th deadline, our admissions committee is currently looking over all applications. If you're interested in applying, you could always go to Delgado's webpage and you can search radiologic technology. and you can look into the admissions and see the process. There are prerequisites. It is a selective admission process. And the next class, if you have not made it for this current fall cohort, the next class will not be accepted until the fall of 2022. And the deadline for applications would be February 15th of 2022. So all that being said, let me stop sharing this if I can and answer any questions that anyone has for me as it relates to the radiologic technology program. So it says here, what does a day as a first year rad tech student look like? So a first year rad tech student, what's going to happen is that you're going to go into the hospital and you're pretty much going to begin shadowing radiologic technologists, and you will have opportunities to assist and eventually take x-rays at the hospital. I hope that answers that. I'm interested in being an MRI tech. How long does additional training take? So what happens with MRI, what we do is we, while the students are in our 2-year program, we offer them an online MRI course that is not mandatory. It's an elective course. If students do take that online MRI course and pass that course, they can then take a clinical component. So I've had students who actually graduate X-ray and for the most part have had their MRI training as well. And when they get out, they are prepared to do MRI from day one. Now, some students, it takes them a little bit longer than that to get all the MRI scans that they need to be qualified. So to be an MRI technologist, you need to, number one, take a course, which we offer. Number two, you need to do the clinical scans, which there is 120 scans that you need over a period of 2 years. So if it takes you only 1 semester or 2 semesters to get those scans, you can then sit for the MRI exam after you have become a registered radiologic technologist. So can you do it in our program while you're in our program? Yes, you can. All right, let's see. Let me find out where I'm at here. It says here, is a degree required for the program? So the way our program works, we have 8 what we call prerequisites. Those 8 prerequisites can be taken at Delgado, and there is no degree that's required. When you graduate from our program, you get an associate degree. The medical sonography program is a post-degree program, so they're getting a certificate past the degree. So our program is you just need those 8 prerequisites. You do not need a degree before you apply to get into our program. All right, let's see what else someone says here. Let me follow these chats. I apologize. Is a degree required? MRI. Would volunteering in a hospital and witnessing the radiology department workflow help with the application process? Okay. Currently, I believe Mr. Tubes had said, currently we are not allowing people to do observation hours for credit for applications because a lot of hospitals are not allowing students to come in and observe. So right now, we are not evaluating any student based on observation. Now, like Mr. Tube said as well, we would highly recommend if you can get into a facility and do some observation just so you can see if this is something that you really would want to do. I think that's a big asset, but we don't value that in our admissions process this year because of COVID. Now, come next year, if you're going to be applying for the next group, if the hospitals have allowed students to go back and volunteer, we may turn it, we may say that we will collect and use the observation hours as part of our admissions criteria. All right, let's see where we're at here. Next up says, those who don't get accepted into the program, are they able to apply again the following years? Is there extra courses or steps? All right, so what happens with us is we have 230 applicants. We will accept 50 students. Those students that do not get in, they are absolutely can apply the next year. and we will get their application that'll have the previous year's application and it'll have the new application in it. And we do give credit for people who reapply and they actually try to enhance their grades or enhance their academic portfolio as it was. So we do give credit for students who are second or third time applicants, but only if they are enhancing by taking courses over or doing something different to help them get in. But what you have to understand is that every year the pool is different. One year we may have 30 4.0s. One year we may have 2 4.0s. You cannot control how many students have a higher or lower GPA when they apply. So the pool is never the same year after year. The pool consistently changes. So one year may be very difficult to get in with a 3.0. Another year, a 3.0 may be easier to get in. All right, let's see. It says here in February, I met the February application deadline and I'm scheduled to register for classes Wednesday. If you're going through selective admissions currently, does that mean I can still register? You cannot register for anything in X-ray until you get into the X-ray program. So if you want to register for fall courses, none of those courses would be radiography courses until you get accepted. Once you get accepted, we then tell you what courses to sign up for. So anybody who's applied and they want to get in the fall, if you want to register for some courses just in case you don't get in, you're welcome to do that, but you cannot register for any radiography courses until you get accepted. Once you get accepted, we code you, and that coding is what allows you to register for radiography classes. All right, guys, I appreciate that. Does anyone else have any other chat questions, or does anyone want to ask any questions by turning their microphone on?
All right, that's good. Thank you, Ty, for presenting on the program.
Did I get everything, Nikki, as far as those? I was
Yes.
trying to read those chats.
You did. You got all the chat questions in there. Sorry about earlier. My whole desktop froze and I couldn't get back in.
Yeah, I thought you may have frozen up there.
I did.
Any questions anybody has? Like I said, I am available. If they go to our webpage, all of our information, my contact information from my email address, that's all right there for them if they want to go to the webpage as well.
Awesome. And remember too, all of these presentations are going to be available on our Facebook page after, so you can, I'll put in the comments all the contact information there as well, so you can access it even after this meeting closes. So again, Ty, thank you so much. And our next presenter is Dr. Jennifer, who's going to talk about our vet tech programs, multiple programs.
All right, thank you so much. I'm going to start with the vet tech program first. We have 2 programs at Delgado, veterinary technology, as well as veterinary assistant. So, let's see, give me just a minute here, get my PowerPoint started. All right, let's talk about the vet tech program first. First of all, I just wanted to kind of talk about what is a vet tech. So a veterinary technician, excuse me, is kind of like a combination of many of the other allied health professions in one, except you're dealing with animals. So you're doing things like placing IV catheters, drawing blood, doing physical exams, monitoring anesthesia, surgery, assisting in surgery, taking x-rays, doing lab work, doing emergency medicine work, pharmacy techniques, dentistry, and a lot more than that. I'm not going to play the YouTube video that I have listed down there, but so it's a lot of different skills that our students learn while they're in the program. And keep in mind, you're dealing with different species of animals as well. So we teach our students everything from small mice and rats all the way up to horses and farm animals. So different skills. Mostly we focus on dogs and cats because that's what our accrediting body, the American Veterinary Medical Association, requires. So 80% I'd say is dog and cat, but we do cover other species as well. So different opportunities. There's endless opportunities for veterinary technicians. You can further your education and get a bachelor degree. You can either go on and get a master's in animal science. And I believe they are close to offering a master's in veterinary technology as well. That's kind of in the works right now. Some people go and get an MBA and become managers, or a teaching degree like I did, begin teaching. So there's endless opportunities for veterinary technicians. You can teach it. You can work at a vet school, and where you'll be helping teach vet students. You can work in a veterinary hospital, either general medicine or specialized medicine. You can work for the government. USDA, the military, the Army has a veterinary corps. Also industry, so you can work for a pharmaceutical company, a zoo and aquarium. You can, start your own business. I've had some graduates start pet sitting businesses and become very successful. And like I said, we actually have an articulation agreement with Northwestern State University. They offer a bachelor degree. And so our courses will directly transfer into their program. And then you have, I believe it's one additional year of classes, or it might be 1.5 additional years of classes that you can take online to get your bachelor degree as well. So you can start with your associates and move on and become a veterinary technologist, is what you're referred to if you receive a bachelor degree. So I actually have both personally. So I started with my associates. I wanted to go to vet school initially, and then I decided I wanted to become a veterinary technician because there was just a little more hands-on with the animals. And that's what I wanted to do, with more of the nursing skills. And not only that, but vet school's very expensive and hard to get into vet school. So I chose veterinary technology as my profession. And then I got my bachelor degree online and became a veterinary technologist. And then I went into teaching. So I got my master and doctorate degrees in education, and here I am. So it's really, the opportunities are endless in our profession. So admissions, you need math 120 or 130, English 101, biology 141 and 143 are required before you can apply to the program. You have to take them. So our application deadline is May 1st. So you would need to have completed these by the end of the spring semester. It's a 5-semester program. So we start in applications are due May 1st. We do selections over the summer and orientation, and then we begin classes in the fall semester in August. So we start in the fall, and then we go through spring, summer, fall, and then spring of the following year. So it's a 5-semester program. It is limited admissions. And so like was previously mentioned for the RadTech program, I get a lot of questions about, well, what's the minimum GPA? I can't really say that because it changes from year to year depending on what the other students' GPAs are, as far as whether a 2.5 or a 3.0 is needed. Usually most of our applicants fall probably right around the upper 2 points, like 2.9 or so to 3.0 roughly. But again, it changes from year to year. So we do look at things like, did you repeat a course and get a better grade in it? So we give credit for that. And things like that. But the math and the biology especially are very important because you're going to be taking pharmacology and anatomy, and you need to be strong in those courses in order to be successful in the program. So we don't want to set anybody up for failure there. And then once you graduate, you become you take a board exam, the Veterinary Technician National Exam, and become a registered veterinary technician in Louisiana. Salary ranges. It depends on where you end up working. So I would say anywhere from $16 to $20 an hour is average for this area, depending on if you're in general practice or a multi-doctor larger clinic, or if you work in a specialty clinic. If you work overnight ICU shifts, you typically get paid more. You can become a practice manager where you'll get paid more. I didn't mention earlier, I think research is another area that you can go into as well. So just depends on, obviously some career pathways like teaching and probably research are going to be much higher than this. So this is just assuming you're kind of working in your everyday veterinary clinic. And I already mentioned the 2+2 with, I guess it's 2 extra years. I thought it was 1.5 years, but I believe it's 2 with NSU to get your bachelor's degree. So like I said, our students learn all different species of animals and get a lot of hands-on practices because they're basically in clinics from day one with observations. The first semester, second semester starts clinicals, third and fourth and fifth are externships with some clinicals in specialized areas like exotic medicine and large animal medicine and research animals as well. Students have to learn some hands-on skills with those species as well. Here's just some pictures of some of the animals we work with and some of our students, graduates. We do field trips also. We take field trips to the zoo. We've gone to the aquarium. We've gone to the Audubon Center for Research of Endangered Species. We've gone to Tulane National Primate Center, just kind of trying to expose our students to a variety of different opportunities and animals. So Barnhill Preserve is another place we've gone before. Dr. Rich at, I can't remember the name of his clinic because he just changed it, but he deals with only exotic animals. So our students do a rotation there. We had some students do externships at the Primate Center, at the zoo, all different things. So if you want to become a vet tech, so what you should do is focus on getting as good a grades as you can in your science and math, especially. We do require 50 hours of observation. We're not really waiving it, but we're working with students right now due to COVID. There are quite a few vet clinics that are still allowing the shadowing. So we're still we haven't completely removed it because I do think that it's invaluable. A lot of people that enter this profession don't really know what they're getting themselves into. And so I feel like it would be a disservice to just remove it completely. But if you can't complete your observation hours, or not all of them at least because of COVID, we're just asking applicants to write a letter with their application indicating that. And then I've had students finish their hours in the first semester or something along those lines. So we'll work with you on that. But, if you're just thinking about it for right now, just shadow somebody, if your personal veterinarian, if you have a friend, just to kind of get an idea of what everyday life in a vet clinic is. So you kind of know what you're getting yourself into, whether you can stand the sight of blood, things like that. Because I've had students get in second semester clinical pathology lab making blood smears and they couldn't stand the sight of blood. And that's, unfortunately, that's something you have to be able to deal with in veterinary practices. So, and do your research about the profession. NAFTA.net is that's the National Vet Tech Organization. That's a good resource to get information. But just, talk to friends, people that that are in the profession. These are just some of the courses in the program: hospital, office and hospital management, anatomy, dentistry, nursing skills, pharmacy, surgery, anesthesia, clinical pathology, radiology, externships, emergency medicine, a medicine class where you learn about diseases, exotics medicine, and then large and lab animal. Capstone is to prep for the VT&E exam. And then the last semester, in the 5th semester, you do, our students complete a 12-week rotation at LSU Veterinary School of Medicine as well to see different things that they have, some specialized equipment and specialized things there that other clinics may not have. So again, the application deadline is May 1st. It's found on the website. We are still requiring letters of recommendation. We haven't really had a lot of people have problems with getting those submitted. If you do have a problem, always just communicate that with us. We know because of COVID, things are a little different. So we try to work with students or with applicants on a one-on-one basis there. Observation hours 50, do as many as you can there. A written personal narrative. There's some written questions posted that you should answer and submit. There's the physical standards listed on the website with an acknowledgement signature page, transcripts. I think you can turn in unofficial at first, but we will need official transcripts eventually. So if you can just go ahead and get the official sent, that would be better, unless it's Delgado classes. And of course we would have that information. The college, you need to apply to the college first before applying to the program. And then there is a mandatory orientation also, which this last year was via Zoom. I don't know how this next orientation is going to be just yet, if it's going to be Zoom or in person. Okay, so that's all I have for vet tech. I guess let me go ahead and go through vet assistant, and then maybe if we have any questions, we can do that then. So veterinary assistant is kind of like I compare vet tech to like an RN and a vet assistant to like a CNA. Okay, so it's kind of like a veterinary assistant assists the technician with their duties, well, also the veterinarian, but they basically, they're not going to be, you know, placing catheters, or assisting in surgery. They're going to be doing more things like restraining animals, doing basic nursing care like giving medications and things like that. Basic injections as well. So like subcutaneous injections, which are just like your vaccinations, can be done by vet assistants, but more specialized injections would need to be done by the technician. Cleaning, sterilizing surgical instruments, filling prescriptions, assisting with x-rays, record keeping, all of that are skills that veterinary assistants complete. If you'd actually like to see the checklist, if you go to the NAFTA.net that I mentioned earlier, they have a spot for for assistants, and it gives you a list of the skills that you'd be required to complete in the 2-semester program. And we're in the process of actually getting approval through NAFTA to get our program. There's not really an accreditation for vet assistant, but there's an approval process, and so we're in the final stages of that right now. Opportunities, very similar to vet tech, so hospitals, specialty, general medicine, military corps, Army Veterinary Corps, research, zoo, aquariums, humane organizations, so like shelters, boarding kennels, grooming salons, again, starting your own business. You can go on and get your associates in veterinary technology. So there's endless opportunities for veterinary assistants as well. So you need 2 prerequisite courses, Vet 101 and Vet 103, which are offered online all 3 semesters. And you need to be finished with remedial general education classes. It's a 2-semester program. It starts in the fall. You need 1 letter of recommendation. And then once, here's actually the link to the web page from NAFTA. Once we receive our final approval, our graduates will be able to take the approved veterinary assistant exam. So you get an AVA designation behind your name, much like the RVT for technicians. And just like vet tech, the application can be found online, and it is due July 1st. So, okay. And we also start in the fall, just like with vet tech. We kind of start the classes at the same time, except we start the vet assistant students go 2 semesters instead of 5, but we start them both in the fall semester. Local average is about $12 an hour. You can make more if you work emergency or more specialized things, but I'd say that's a good starting salary that you can probably expect for this area. And then, like I said, you can transfer. A couple of the classes will transfer into the vet tech program. Should you choose to continue, should students choose to continue to go into vet tech. All different animals that we teach, just like with vet tech. And then the last semester, there's an externship that has the hands-on practice at a local veterinary hospital. And so far, we've not had any trouble placing our students in vet clinics. Most of them have still been allowing, 1 or 2 students to come in for externships. We haven't had any problems there placing students. These are just the same pictures I had in my other presentation. If you want to be a vet assistant, so again, focus on getting good grades, shadowing, kind of similar to vet tech, talking to family or friends who are in the profession, doing research about the profession as well would be a good idea. These are the courses. So nursing, husbandry, ClinPath, and pharmacy is the first semester, and then radiology, externship, surgery, and then office procedures and hospital management is the second semester with the 2 prerequisites. And animal health careers is a good one if you're not sure what you want to do, but you want to do something with animals. It goes through every single veterinary profession, like veterinarian, vet tech, vet assistant, groomers, receptionists, zookeepers, kennel workers, everything, and kind of gives you the history of the veterinary profession. Actually has a long history dating back to BC. So we go through all that in that course as well. So again, July 1st is the deadline. It can be found online on the Delgado site. Just use the search bar and type in vet tech. It'll bring you to our main page, and then Vet Assistant has a tab there. Just like with vet tech, you would need to do this physical standards acknowledgement. 1 letter of recommendation is required, transcripts from other colleges, a college application, and then we also will have an orientation for the vet assistant program as well. Okay, so that is all I have. It's kind of a lot. I know I went through it fast. So if anybody, let me stop sharing this first. If anybody has questions, let me know.
I'm not seeing any questions in the chat or on Facebook here. If y'all have questions though, you can unmute and ask those questions now, or you can pop them in the chat real quick. Otherwise, thank you all for joining us today, both in our meeting here and on Facebook. And Jennifer, Michael, and Ty, thank you so much for presenting on these programs. I learn stuff even every time y'all do these. I feel like I learned something new. So I thank you so much for being present today for our prospective students. And we have one more event today, actually starting in a couple minutes for Images Magazine. We have multiple events throughout the rest of the week. So y'all, pop on to our website, check out Community College Week, and sign up for those other events. And thank you all for joining us, and have an awesome day.